Preceptorship Foundation. The main purpose of the Preceptorship Foundation, by the completion of this workshop, the participant will be able to determine the essential facts related to the concepts of preceptorship, including the critical thinking approach. Learning outcomes. By the completion of this workshop, the participant will be able to define the following terms, and he has to differentiate between each: preceptor, orientee or preceptee, preceptorship, body, mentor. Also, you have to explain briefly the philosophy of education, discuss the main principles of adult learning, apply the main principles of adult learning to being a preceptor. Teaching methodology. Some of these teaching methodology will be applied and the others will be not. Lecture discussion, group discussion, scenarios, case presentations, small group activities, role play, demonstration, one-to-one coaching and training in the clinical area. Teaching materials: whiteboard and markers, flip charts, papers, LCD projector, associated handout like manual, worksheets, competencies, etc. Evaluation methodology will be immediate feedback, progress test pre and post, clinical practice competency, reaction form for the participant and facilitators, and follow up after 6 months. Now, what's the meaning of preceptor? Preceptor is a registered nurse who, as a part of his or her role, provides facilitation of learning in the clinical practice setting to a range of learners, such as nurses working in a different track areas. Preceptor can be defined as an experienced registered nurse who provides support and guidance to preceptees during clinical placement. Preceptors may also provide transitional support to new graduates and staff members within their healthcare agencies. Preceptee or orientee is any newly employed or transferred from any agency registered nurses who is hired to work in any area of TMC Aramco project. Preceptee as well can be a new staff member, course participant, or rotating staff member who is undergoing a formalized orientation process to a clinical area in the RAC. Preceptorship, now it is the process, it's a pathway to leadership development and fosters nursing excellence for the TMC. Preceptorship is a form of educational and supportive relationship which is intended to provide a newly qualified person or someone who has changed their role, like a new member of staff or returned to practice. Body is a member of staff who has been identified as a primary support person during a specified period of time, such as one shift, by the orientee and or any member of staff requiring support. So the body always identified by the staff themselves, if they are aware and they are trust them and they know them, they know that they are can be trusted and they can help them in precepting. Mentor is a respected senior colleague who a nurse can turn to in order to seek advice on a range of professional issues, or a mentor is an individual that the nurse chooses to go to, and this relationship may or may not be officially recognized. So the mentor can be as a consultant, as an advisory, as a reference for you. Maybe you will ask him an advice and he may be senior staff nurse, maybe he is only have good experience, enough experience, not necessarily to have a good preceptor, to be as a preceptor. The philosophy of education. Philosophy of education is important, and because it's important, we have to answer the following questions. How do preceptee learn? We have to ask this question. We have to ask as well, how do preceptee and teacher attitudes, values affect learning? Is there a relationship between both of them are mutual, with respect, with trust, with collaboration? What is the role of evaluation in the teaching learning process? How do you evaluate the staff, as we do now, pre-test, post-test, or competency, or there is a feedback or observational? And also, are some teaching strategies more effective than others? What are these strategies that it makes the education more effective? We have to review the exercise number 1, please, and this will be submitted later separately. Now, factors that affect learning working style. Usually, we have to adhere to the adult learning principles, how the communication is received, general values, and learning styles. Principles of adult learning. Now, the principles of adult learning is very important. We have to understand it, especially in regarding to communication and language. Adult learners are goal-driven. Language and literacy are social processes that involve interaction with others. Language and literacy development require risk-taking. Language and literacy develop when the target language is slightly above the current level of proficiency of the users. And because of that, we have always to simplify our language and make it slowly, clearly, and concise for people who are not their native language is English. Language and literacy development require focus, engagement, and practice. Language and literacy are multidimensional and require different kinds of interactions with different kinds of genres. Language and literacy develop through interactions with tasks that require cognitive involvement. Language and literacy develop more deeply if skills are connected or to an overall topic or theme. What adults as learners characters? The characters of adults as learners: self-directed, they want to be actively involved. Relate new knowledge to life experience, previous knowledge, and this is very important. You have always to relate their experience. You have not to ignore their experiences. They are goal-oriented. They are aware about what they want to know. Must have a reason for learning. What are these reasons? Is it a motivation or is it an interest? Practically want to learn to be useful. It must be practical. This learning must be practical. It must be able to be practiced. Because of that, they will be more useful for them. Wants to state their view. Want to state their views to be recognized, be accepted, feel important, to be respected. The principles of adult learning into being a preceptor. The main principles of adult learning are often referred to in education of preceptees in any discipline. The following is a brief outline of principles of adult learning using the mnemonic SMART T. SMART T, which means S, student-centered; M, motivation; A, activity-based; R, review-reinforced; T, transfer; I, interest; E, environment or enthusiasm. S, student-centered. You have to focus on the student needs, goals. M, motivation. You have to have always motivation. We have always to give awards, or maybe they can support the staff or the learners with the words, positive motivations. A, activity based. It must be practically acceptable and they have to practice it. R, review and reinforce. Again, motivation, reinforcement. T, can transfer this information, this knowledge to their practice, to their life, real career. I, interest. It must be their sort of interest. And lastly, environment must be healthy and supporting the education with enthusiasm. Thank you for this first lesson. We will continue next.